Hi, I'm Raymond Diconta, an anesthesiologist from Cameroon, and today I'll be doing a demonstration on how to do a Fascia Iliaca block. The Fascia Iliaca block is a very interesting block for lower limb surgery, especially surgery involving the right lateral, the lateral side of the leg, of the leg, and especially surgery involving the femur. It is also used in, together with the femoral block to ensure for procedures that involve the limb, the upper part of the limb. So it is a block which usually is difficult to find, and usually I prefer combining a landmark approach to find out exactly where the nerves pass, and before putting my ultrasound probe and going ahead with the block. So to initially get the landmark, we do like a one-third section of along the iliac line, and that we take the external third, and it's between the iliac crest and that external third that we place our ultrasound probe. So we assume that we have done the standard cleaning on our patient. We put a bit of gel on the area. Now we place our probe, which is a linear probe, and we should have an excellent view between 5 to 6 centimeters so that we actually get to see the iliac crest. Now, when we place the probe, okay, this spot should be that way. Now, as you can see, we've placed it on the external third, okay. Trying to find it. Okay. Let me see. Okay. Turn it this way. Good. So here we can see at the bottom the image of our bone here. And the image we want to have is the image of the iliacus muscle, which passes over the iliac bone. And that we can now, we have that large muscle going over the iliac bone here. So this is what we see. And this is the iliacus muscle which we're looking for. And we want to use, when we insert our needle from the bottom going upwards, we should see our needle coming from the right of the screen at this point. We want the needle to get into this fascia, which is the fascia iliaca. We want it to get into this fascia, and so we will insert the needle at this point. The needle emerges in the screen here, and when we get to this point and we cross the fascia, we inject fluid or local anesthetic and have it run through this fascia, going through past this vascular passage and all the nerves which are at this level. This is called the suprainguinal approach, which is quite an easy one with the ultrasound, and it gives it a more practical approach because we can actually see the muscle flowing like a river over the iliac bone. It's a volume block and will require about 30 to 40 mils of fluid injected over this fascia and running over this space to cover the right side of the limb. Thank you.